Hello, I'm here to share with you 5 tips for how to manage menopause. First and foremost, you must recognize the different signs of menopause. This is not just about hot flashes and night sweats. It is about that, but it is not limited to that. Menopause can manifest in so many different ways. It can affect the mind, so there can be brain fog. Many of you are probably familiar with that. There can be thinning of the hair, dry skin, dry eyes. There can be mood swings. There can be mid-weight gain, constipation, sleeplessness, urinary tract infections, vaginal dryness, painful sexual intercourse, osteoporosis, colon cancer, there's an association there, and even Alzheimer's disease. So the lack of estrogen has many, many implications. And what makes me crazy is when I have a patient come in and see me and say that she brought up all these myriad symptoms to her doctor and walked out with several prescriptions. Now she has a mood stabilizer, she has a sleeping aid, she has something for osteoporosis, and she's been given something for constipation and for her weight gain. 5 prescriptions. When if somebody had at least asked the question, where are you with your changes and have you ever been offered any hormone replacement, you might have been able to bring that down to a single prescription. That's number 1. Recognize the many, many ways that menopause manifests. Number 2, you must educate yourselves. You are smart women, so many smart women, and yet why don't we educate ourselves on this? Why do we just accept that estrogen may not be for me? Estrogen does not equal cancer. Estrogen is not all about cancer risk. I do know where that came from, but that is not true. And you have to delve a little bit deeper. It requires a conversation. It requires attention to your specific risks, but it is not true that because you have a maternal aunt who had a history of uterine cancer or some other form of cancer that you are not eligible for estrogen replacement. That is simply not true. There are great organizations out there, the National Menopausal Society, ISWICH is the International Society for the Study of Women's Sexual Health, another wonderful organization, and they can provide good information, evidence-based, that will give you the information you need to address these issues safely. So you must educate yourselves. Then assert yourselves. Assert yourselves. You can go to a doctor's office and say, well, wait a minute, before you give me all those prescriptions, can we talk about hormone replacement? And if your doctor isn't responding, change doctors. There are plenty of doctors out there now who are addressing these issues because it is so central to our health. So if you're not getting the answers you want, I promise you, there are other doctors in your area who can help you. Next, embrace change. Embrace this change. We are going to spend close to half of our lives in menopause. That's a long time. So are you going to accept this generalized depressed mood swings, the hot flashes, the sleeplessness, the weight gain? You don't feel so great, you don't look so great. Why would we accept that? This is an estrogen deficiency problem. Why would we accept all of that? Address it. Am I a candidate? How can this be done safely? And I would like to restore my estrogen so I can feel that vibrancy that I'm seeing in other women. Next, we want to heed our bodies. Heed our bodies. Listen to your body. If you are waking up with aching joints and that extra weight and this fluctuating mood and just not feeling great, listen to your body. You can address that. I just feel you really want to make sure you have paid attention to hormones, and I'm not restricting that to estrogen. You have testosterone that is important. You have cortisol that's important. Your thyroid is important. There are many hormones that are working in concert to make you feel healthy. And when we lose that estrogen that's so important for our vibrancy and our health and our femininity, we lose a lot. So what did I say? I said, recognize the signs of menopause. I said, educate yourself. I said, assert yourself. I said, embrace change. And I said, heed your body, R-E-A-C-H, reach. Reach within, figure out what you don't like, reach out to find a doctor, and reach for the stars in terms of what you want to have for your own health, And I promise you, if you open your mind to this and accept and embrace change, you are going to reach your health goals. Good luck.